We are talking about premature ejaculation, one of the most common sexual concerns among men. We're going to explore what premature ejaculation is, why it happens, and some various ways that you can address it, from medical treatments to psychological techniques.
Welcome to a Pleasure Program Quickie. My name is Holly.
I'm Victoria.
We are two licensed therapists specializing in sex therapy, here to answer your questions and share our knowledge around all things related to a healthy and pleasurable sex life. We are calling this a Pleasure Program Quickie because we are providing information around a sex topic relatively quickly.
Premature ejaculation is when an individual climaxes or ejaculates sooner than he would like to during sex. This is usually considered less than 2 to 3 minutes of intercourse.
Premature ejaculation is one of the top sexual complaints by men. About a quarter to a third of all men have expressed struggling with ejaculatory control.
Now that we know what it is, let's dive into a few potential causes for why this may be happening. There may not be an explicit cause for why it's happening. We may not know sometimes, but there are some theories that we can pull from. The first one is regarding serotonin. Serotonin is a natural substance in your body that's made by nerves. It helps to control the way the brain manages mood, emotion, sleep, and sexual desire. Low amounts of serotonin can shorten the time to ejaculation and lead to premature ejaculation. This can be linked to substance abuse. So, for example, opiate-dependent men have a prevalence of premature ejaculation 3 times higher than men who are not opiate dependent. Alcohol and methamphetamine have also been associated with premature ejaculation.
That's interesting because you hear that alcohol can sometimes delay ejaculation. So in some cases, it actually can contribute to premature ejaculation.
Exactly. And it's true. It can delay or it can cause it to be premature.
More rarely, premature ejaculation can actually be caused by a prostate gland issue, such as inflammation or a spinal cord issue. So make sure you check with your doctor first to rule out that something physically isn't going on.
Right. They may want to examine your prostate or do some neurological tests just to make sure everything's functioning correctly.
There's also a theory that premature ejaculation is related to hypersensitivity of the penis. We don't have much more information on that other than it's a theory.
So on that topic of hypersensitivity, let's get straight into some treatments that we can look at if you're struggling with premature ejaculation. If everything looks good medically, then, and you're thinking that it might be due to hypersensitivity, we could look at some anesthetic creams or sprays that they have out there. And basically what these do is that they numb the penis. There seems to be some conflicting research and feedback around whether it actually works. There's some negative feedback around these. They're to be applied no more than 30 minutes before intercourse, so it could interrupt the flow or interrupt impacting desire if you're trying to time it correctly. There can be a taste to it that might deter fellatio, which is oral sex if you don't know what that means. And because it is numbing the penis, it interferes with pleasure.
Yeah, that makes sense.
So, pros and cons here. If your one goal is to extend the session, it seems like they can be beneficial and they can work, but there are some cons to consider.
So some individuals will try acupuncture or herbal medicines as a form of treatment. And some research has indicated it can extend intercourse for an additional 1 to 2 minutes. And it might be more preferable for some people who are looking for a more natural alternative to treatment, who don't like the idea of some of the cons we just mentioned with the numbing forms of treatment. So this might be a good one to consider.
There's also the option of looking into getting a medication prescriber to prescribe antidepressant medications. Even if you're not struggling with depression, these medications could be prescribed to help with premature ejaculation. You might be prescribed a low dose of a SSRI, which is a selective serotonin reuptake inhibitor. An example of this might be Prozac or Zoloft. These medications have been shown to be helpful for premature ejaculation. They can cause a range of a few added minutes, but they can also then delay ejaculation or completely inhibit it. So those are some cons of that too to consider.
If substance use or abuse is a factor for you in your premature ejaculation, then seeking out some treatment to treat that issue is going to be really beneficial, not just for premature ejaculation, but also just other areas of your life, right? Substance use and abuse can really take over a person's life, impact a variety of areas in your life, your ability to function. And so it's worth seeking out treatment. You can seek out a therapist who specializes in substance abuse treatment. There are also treatment programs, even rehabilitation centers, variety of options, AA or NA. So definitely worth considering if you think substances is one of the primary causes.
Also, therapy could be great beyond treating substance abuse issues for a variety of reasons. You know, we have a few previous videos talking about pornography utilization and some of the negative impacts that can come from that. And one of them is that a lot of people get their sex education from pornography. It can be a vulnerable thing to try to seek sex education, and pornography is easily accessible, so it's understandable why that is. But pornography is typically fixated on genitals, right? So this can cause overstimulation and premature ejaculation. There's not usually a lot of lengthy foreplay, as we can call it, and therapy might help you to kind of discover more leisurely, playful massage and the anticipation leading up to actual intercourse, taking focus off the penis and providing more sex education.
So taking the focus off of the genitals and just focusing on enjoying the process of pleasure, regardless of whether or not ejaculation occurs what you would consider quickly or within 1 to 2 minutes once some sort of penetration or intercourse is happening. So it's about the whole experience, not just the genital experience, right?
And hopefully also it takes some of the pressure off by teaching more about female pleasure and it being more about actually like clitoral stimulation rather than penetration, right? So there isn't so much pressure around the length of the session. We also have an erectile dysfunction video. Anxiety can cause erectile dysfunction. However, both erectile dysfunction and anxiety can also cause premature ejaculation. Erectile dysfunction and anxiety go hand in hand. So if you're experiencing erectile dysfunction, but you're having a successful session, you might be anxious about the length of how long this is going to last. That might make your nervous system more excitable and prone to ejaculate quickly. So therapy can also teach relaxation techniques such as breath work to assist in the anxiety or assist in the erectile dysfunction that's causing anxiety. So check out that video if you find yourself ejaculating too quickly from your perspective due to the rushing, so that you don't suffer from these kinds of symptoms related to it.
Right. Basically, anxiety is going to contribute to either problem. So if you
100%.
are seeking out therapy to treat your anxiety, it's only going to help, not hurt. Another useful tool that you can learn to use through therapy is mindfulness. This is where you really practice being very present and noticing the sensations in your body so that you can identify that point of no return leading to ejaculation and act quickly as an intervention. So you can practice a stop-start technique that you can learn to use through practicing mindfulness so that you can prolong your erection and delay that ejaculation. And so that's something that mindfulness that you can learn through therapy can assist you with. Something that came up in research is something called the squeeze method. It seems a little questionable. Seems to be about just about everywhere when you do research on premature ejaculation. It's a strategy where you or your partner squeezes the penis to prevent ejaculation. I think that seeking out medical advice before practicing such a strategy would be wise, because it sounds like it could potentially be risky. So I'm not sure if we would actually recommend that. In case you are doing research, maybe that's how you found this video, and you come across this squeeze method. I don't know. It sounds a bit risky.
I agree with you. It is everywhere. So it's a popular recommendation, but it's hard for me to imagine confidently recommending an approach that you're basically punishing, because it feels like a punishment. That, to me at least, it doesn't feel right. So
it doesn't sound like a pleasurable part. Yeah. And really the purpose, right? Pleasure is the measure. It's the purpose here. So if you're engaging in something that feels jolting or alarming, is not pleasurable, it's, could even be painful potentially, you got to question if it's worth it.
I think the last kind of recommendation here is if you're struggling with premature ejaculation and you're looking for help and you are in a relationship, we would suggest trying out relationship therapy, couple therapy. It can assist providing the same psychoeducation to your partner, helping you receive this adequate support, reducing the pressure that's involved in premature ejaculation, reducing shame or embarrassment that's extremely common for men who are suffering from this, and just help you guys work as a team to find mutually satisfying solutions, such as maybe taking breaks or maybe wearing condoms or having multiple sessions. It's worth trying and talking about.
Right, and keeping pleasure between the two of you the focus, right? Versus a dysfunction that, or pathologizing one person or their penis, just being able to work with what you've got, build upon the positives, and see where that takes you. I think that can be a really a beautiful and empowering process in couples therapy.
For sure. You are more than your session length, right? You have way more to provide than some reduced number of minutes that's going on here. So I know it's hard for men to not feel like they're reduced down to size or frequency or session length, but you really are so much more. So try to see that and challenge any shame or embarrassment that's going on. You are not alone, and I hope that this video helps you to connect with other men suffering from the same issue.
If you liked this video, feel free to give it a thumbs up. Maybe consider subscribing. We have a series called Pleasure Program Quickies, where we cover a variety of sex education topics. We also have some other playlists where we react to Reddit posts about real people and their real sex lives, and we give our 2 cents and our thoughts and feedback. We also answer viewer questions. So check out some of our other videos. Thanks for giving it a watch, and we'll see you next time.